back to Daybreak this morning. According to the Center for Medicare and Medicaid Services, 80% of people eligible for dual special needs health plans are actually not enrolled in one. With annual enrollment right around the corner, it's important that people know who qualify and if they might be missing out on those additional benefits. So we have Karen Jones with us this morning with the National Caucus and Center on Black Aging to help explain this plan. Karen, good morning to you.
Good morning to you. Thank you for having me.
Yes, it's a pleasure to have you here. Some very important information to discuss. What can you tell us about this plan?
Well, 8 out of 10 people who receive Medicare or Medicaid are not taking advantage of these dual special need plans, which give people extra and additional benefits to their health care coordination. We are trying to encourage people during this process while Medicare enrollment begins October 15th, but we're trying to make a real campaign awareness to people who don't know about these dual plans and might be leaving additional services, health services on the table. And so we're really reaching out and trying to get this information out to everyone so that they know that there's much more to their health care if they take advantage of this program.
Certainly, and that is a lot of people who might be missing out. How would someone know if they qualify for the dual plan?
Well, again, it varies from state to state, but these dual plans are available in all states, and if you're receiving Medicare or you're receiving Medicaid, you could be missing out on vision tests, on hearing tests, on dentist visits, and other services. And so we're encouraging people, because we know that the process of choosing a health plan and going through Medicare or even Medicaid can be complex and can be confusing. But we do know that in addition to those plans, you can also apply for these dual plans and see if you are eligible for additional services. For example, we assisted a man who we found out had not had a vision test in several years. We enrolled him into one of these dual plans, and now he was able to get a vision test and new glasses. He also found out now he can get his hearing tested. He can look at other services that assist him in preventive care rather than something turning into something worse. And so we're encouraging people not to leave these benefits on the table. Find out if they're eligible. We're talking about parents, grandparents, people with disabilities, people who are eligible, again, for Medicare and Medicaid, to make sure that maybe they might be losing out and not taking advantage of these dual plans in their state.
All right, Karen, well, we appreciate you being with us here this morning. If you would like some more information on this, don't forget you can go to www.getdual.com or call that number you just saw on your screen. Karen, thanks for being here.
Thank you so much for having me.
Absolutely. Daybreak will be right back after this.